How did you decide to give to Rat Advocates?
And I think money that is donated to Rat Advocates can go a long way in the sense of just helping to spread the word and helping to bring awareness. These are a lot of kids out there that are affected by this. So trying to get involved in identifying the diagnosis, trying to get the resources available, not only for the kids, but also for the parents, and trying to figure out which strategies work. And this is where organizations like this can be helpful because parents can get together and discuss things that work, things that don't work, and at least feel supported or not feel isolated when they realize that they're having these difficulties there. And hopefully awareness of reactive attachment disorder just continues to increase too.
Yeah.
And treatment options and will continue to improve hopefully.
And social workers need to be aware, because even when we found out that she had RAD and we told the social worker at the time, she could care less. That wasn't important to her. What was important was her seeing her biological dad and all these other non-factors. They need to be aware. And more psychologists went to Better Health, I think it was, right? And I'm going through looking at all the bios, and I couldn't find anybody that had any experience in RAD, and that was very frustrating. I finally found someone, and when I'm talking to them, they didn't understand it. They couldn't relate with me on any of the topics, so I stopped.
And you're a physician, you said. What's that like for you, looking around and seeing so many professionals that don't understand what this is?
Yeah, again, it's frustrating, and and there's probably a ton of obviously it's not only foster kids that have reactive attachment disorder too, right? There's probably just a lot of other kids out there, a lot of adults out there too who are just dealing with it and stuff.
As a physician, did you know what it was before
you
adopted?
No.
Yeah.
No. It's not the diagnosis that's in the DSM manuals or anything like that. So I think again, it's just awareness of it, and there's so much education that is lacking just in healthcare in general, right? I mean, there's so much to learn, and then there's so many other conditions though that are just kind of up and coming, but whether it's medical education or seminars or like this organization, if they offer, I know they work with therapists or they have training classes for therapists, so things like that will be important, because again, it's not necessary that the physicians know everything about reactive attachment disorder, simply that they know that it exists,
right,
and being able to point someone in the right direction.
Mm-hmm.